From the JAMA Network, this is JAMA Psychiatry Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Psychiatry.
Welcome to the JAMA Psychiatry Author Interview podcast. I'm your host and web editor, Dr. John Torous. Today we're thrilled to be discussing a new paper just out in JAMA Psychiatry, the Association of State Cannabis Legalization with Cannabis Use Disorder and Cannabis Poisoning, Evidence from Employer-Sponsored Health Insurance. We're about to be joined with the first and corresponding author of the paper, Dr. Jayawardhana, PhD, in the Department of Health Management Policy, College of Public Health at the University of Kentucky in Louisville, Kentucky. Today, more and more states in the U.S. are passing laws that allow for the medical or recreational use of cannabis. With this rising use, are these states also seeing rising problems like more cannabis use disorder or more cases of cannabis poisoning? What are the public health implications of these legalization efforts, and what do states need to expect or be prepared to encounter around potential adverse or problematic or dangerous uses of cannabis? To answer these questions, we'll explore the results in a brand new study just out in JAMA Psychiatry. So, Dr. Jayawardhana, thank you so much for joining us. And as a way of introduction to this whole topic, let's start by defining what is cannabis. Is it the same as marijuana and THC or CBD? Let's just untangle what is the substance we're dealing with here and what is it not?
Sure. And first of all, thank you very much for having me, Dr. Torous. So cannabis is actually more of a general term that's being used to refer to all products coming from the cannabis plant, whereas actually marijuana is products derived again from the cannabis plant, but it tends to include a substantial amount of THC. And you asked the difference between THC and CBD. These are also the two main compounds of the cannabis plant, but they tend to have very different effects. THC actually has psychoactive effects, meaning that it can affect a person's mental state, or meaning can produce sort of noticeable mind-altering conditions when somebody consumes THC, whereas CBD does not have psychoactive effects.
That's very useful to understand what we're talking about, really, in the THC or marijuana category. And how many states do we know have legalized medical or recreational use of cannabis? And is this a trend that you see continuing? We're not here to predict the future, but are we going to see more or less, do you think?
Yes. So I think last I checked, 39. I say that because this is sort of changing as we speak. So about 39 states and District of Columbia has legalized medical cannabis use, and about 24 states and DC have legalized recreational use of cannabis. And I think in terms of the trend, I think it is likely to continue because we are living in a political climate in the US where cannabis is increasingly legalized at the state level. So there's sort of this peer effects too. When one state legalizes it, sort of the neighboring states feel the peer effect and they are likely to legalize. And also there's this public perception that cannabis is relatively harmless. So.
And I think, again, we're not here to talk internationally, but I think even other countries are thinking about moves towards this if they haven't already. So definitely a relevant topic. And as you kind of alluded to, there can be recreational use, there can be medical use, we understand that, but there can also be uses that result in things such as cannabis use disorder. What is cannabis use disorder and how common do we think it is?
So cannabis use disorder, actually, in this paper, we define it following the International Classification of Diseases. They define cannabis use disorder, or CUD, as a psychiatric disorder that's sort of characterized by cannabis dependence or continued use regardless of impairment, and also harmful use or inappropriate use of cannabis. About, I think, 30% of cannabis users are affected by or diagnosed by with CUD or cannabis use disorder in the US, at least.
So that's pretty common in some sense. That's not a small number we're talking about here.
That's true. Yeah. Because I think in the US, we have about 62 million users of cannabis. So, yeah.
So it's in the 20 millions at least, if not a little more. And then there's also the paper you cover talks about cannabis poisoning. And I think that may be a term that some of our listeners haven't heard about. What is cannabis poisoning?
So cannabis poisoning actually takes place when someone consumes too much cannabis at one time or sort of overconsumption of cannabis.
And it makes sense when states legalize this for recreational medical purposes, we're likely going to see more use. But in the question, right, is does more use also mean that we have more challenges like cannabis use disorder or poisoning? And again, that connection is not guaranteed, right? More people could be using it recreational and not having challenges. So what did we know about the association of legalization and cannabis use disorder and poisoning before you did the study? What was the state of the literature before you and the team embarked on this exciting results that we'll talk about?
So you're correct, as most states are legalizing cannabis. So more cannabis become available in the markets so there's easy access for people to purchase or consume cannabis, which tend to increase cannabis use, of course. And this was also confirmed by prior research. In addition to that, previous research also has looked at sort of the prevalence of cannabis use disorder and cannabis poisoning in comparing sort of states that have legalized cannabis versus the states that have not legalized. And what prior research confirmed was that they see higher prevalence of cannabis use disorder and cannabis poisoning in states where cannabis is legal.
And with that background, what was the question that you and the team set out to answer? And what was the gap in the literature that you guys were aiming to fill?
So most of the literature that have looked at this question prior to our research has looked at sort of prevalence or incidences, just sort of looking at trends. However, we wanted to look at more of comparing states that have legalized versus not legalized. Are there any specific associations with this legalization, both medical and recreational cannabis? So in this study, basically, we examine association of both medical and recreational cannabis legalization with cannabis use disorder and cannabis poisoning using data from employer-sponsored insured population. And also we examine these associations broken down by either male or female or by age subgroups as well.
So that's a lot of results and comparisons we'll talk about. So again, compared to prior studies, we're looking at both medical and recreational. We're looking at states that have it versus have not done it. And we're looking at more stratifications as well. So we're really going to get a very good comprehensive picture, not just what's happening, say, in Massachusetts or what's happening in California. We're going to hopefully get this national picture. And to do this, you and the team use a data source called the Mariative Market Scan Commercial Claims Encounter Database from 2011 to 2021. That's a tongueful. I won't say it again. But what is this database and who is in it? And more importantly, who are the people that you pulled from it to do this analysis?
Great question. So yes, so this Mariative Market Scan Commercial Claims and Encounters database that it basically includes medical claims or insurance claims data from employees as well as their dependents. So if you're employed, you get insurance, you're covered as well as your family members are covered. And so we limited our study to people who are sort of basically adults, so the ages between 18 and 64, as well as we limited our study to people who are enrolled in the insurance plans minimum of 1 year or more. So with that, we ended up with a little over 110 million enrollees in the study sample. Yeah.
That's a big number, 110 million.
Well, we have a larger time period too, yes. And 1 year minimum continuous enrollment was important because people tend to go in and out from insurance if they are especially changing employers, etc. Yeah.
That's true. But I think so. From this large number, you and the team, you merged the state level, it's called the market scan data, with kind of different changes in policies between 2011 to 21. Different states were making these changes. And you also took different socioeconomic variables. You basically created a new data set. What were the policy features, the core ones that you guys were coding or tracking?
So the primary policy variables we were interested in sort of examining this association between cannabis use disorder and cannabis poisoning, whether a state has passed medical cannabis law, if a state has actually opened medical cannabis dispensary, because some states pass legalized medical cannabis. For example, Kentucky right now, we have legalized medical cannabis, but we do not have a medical cannabis dispensary open yet in the state. And also some states allow home cultivation of medical cannabis. So that's another policy variable we are interested in studying. And also then if a state passes recreational cannabis use. So those are the four primary policy variables we were interested in studying, examining their effect with the cannabis use disorder and cannabis poisoning.
And in terms of the primary outcome of interest, what was that and how did you code it? And let's talk about the main secondary outcome. You have so many fantastic outcomes because you have so much data, but let's focus on the most important ones.
Yes, sure. So our primary outcomes, so basically two primary outcomes. One is the cannabis use disorder. The other is actually what we call cannabis poisoning is non-fatal cannabis poisoning because we don't have the death identifier in the claims data. So we coded cannabis use disorder and cannabis poisoning outcomes as the number of enrollees either with cannabis use disorder or cannabis poisoning diagnoses per 100,000 enrollees per quarter. And our secondary outcomes were basically looking at these two primary outcomes, but broken down by sex, like male, female, as well as by 4 age groups between the ages of 18 to 64.
And now that we understand how you set up the study, let's jump to the main results. And what did you and the team learn around cannabis use disorder?
So what we found is that states that have legalized medical cannabis experience about 43% increase in cannabis use disorder diagnoses compared to states that have not legalized medical cannabis. We also found that medical cannabis laws were associated with increases in cannabis use disorder, both among female and male populations, as well as across all age groups. The interesting part is, however, is that actually the relative increases in cannabis use disorder was higher among female population compared to male population and was also higher in the age group 35 to 44 compared to other age groups.
Those are some very important results to consider. And 43% again is a relatively notable number alone. And the gender differences, perhaps we'll talk soon about that as well, because I think perhaps by stereotypes, people may not have always expected that. But of course, you were looking at cannabis poisoning as well. And what did you and the team find as the high level results around cannabis poisoning?
With cannabis poisoning, we saw that states with medical cannabis laws as well as states with recreational cannabis laws experience increases in cannabis poisoning compared to states without these laws. And similarly, we saw that states with both medical and recreational cannabis laws also saw increases in cannabis poisoning in both male and female groups, as well as all age groups, except in this case, people who are 35 to 44 age group.
And there's so many more results. I encourage everyone to look at the details of the paper and the tables. There's so much coded, so much information. But maybe, Dr. Jayawardhana, is there any other key results that you think listeners we need to cover right now because it's so important? Not to say the ones we won't cover aren't, but there's just a lot in here.
Yeah, so I think let's go back to previous about the cannabis use disorder discussion we had. I think what's important to highlight here is that in our results, we found that female population experience higher relative increase in cannabis use disorder and cannabis poisoning compared to male population in states with medical cannabis legalization compared to states without medical cannabis legalization. I find this interesting because cannabis use is generally more common among men than women. So a person would not assume these results in a way because they would think people who are using frequently may be experiencing cannabis use disorder. But yes, so what we are finding is actually maybe people who are not used to using it frequently may experience these adverse health outcomes like cannabis use disorder.
That certainly makes sense as one interpretation of what it could be. And of these important results that you have, I imagine this is of interest to policymakers in states that have past legalization efforts to think about what extra health resources they've needed, and perhaps of interest to states that haven't passed or approved to think about what could be some of the extra resources or consequences of these actions. What would you want, again, those policymakers perhaps listening to this podcast, hopefully reading the paper, to take away as they kind of have to balance what the public wants and perhaps health needs that you're uncovering that we didn't know about before?
Yeah, that's a great question. I think, yes, the findings of this paper is, I think we emphasize the importance of coupling cannabis legalization by states with other effective policy tools or policy interventions to reduce harms associated with cannabis use, such as this increasing cannabis use disorder or cannabis poisoning cases taking place. So some examples of these policy tools could be things such as placing quantity limits for purchasing of cannabis or limiting potency of cannabis products available on the market. Because I think when states were legalizing most in the past, they did not have this much information about possible adverse effects of cannabis use. And I think more and more information come about adverse effects of cannabis use. I think that information will be valuable for policymakers to come up with effective policy tools.
Yeah. No, I believe in prior podcasts we've covered the potency of cannabis is definitely oft on average higher today and much higher than it has been in the past for it.
Definitely. I think because the cannabis products in the market nowadays, the potency is way higher than the cannabis products you would have seen in the 70s in the market.
And one of the results I want to talk on is you have these interesting time lag results because, again, you looked at data over a decade. And could you briefly touch on some of the insights that you saw from the time lag results and potentially what that could mean?
Yes, definitely. So, yeah, what is interesting in the studies, we were also able to look at how these policies are affecting these outcomes, the two key outcomes that we are interested in looking at cannabis use disorder and cannabis poisoning diagnosis over time. So we see that states that have legalized medical cannabis started to experience significant increases in cannabis use disorder or cannabis poisoning diagnoses only starting around sixth quarter of the post-policy implementation. So 6 quarters is basically about a year and a half since the policy has been implemented by a state. Yes. So that basically tend to indicate that individuals may develop cannabis use disorder or experience cannabis poisoning with medical cannabis use in the long run, not in the short run, right? So obviously it may take time to develop cannabis use disorder as well. On the other hand, we saw significant increases or a significant jump in cannabis poisoning immediately following policy implementation, especially recreational cannabis legalization, indicating basically that individuals start to experience higher risk of cannabis poisoning with legal recreational cannabis than medical cannabis. So this might be because, again, there's no limits on the quantities of recreational cannabis one can purchase, or there's actually, I don't know even whether individuals are able to find out the potency of recreational cannabis on the market. I don't know if the labeling is available for such products.
But those are interesting results for thinking about what could happen if a state or country or region is to legalize it, and perhaps understanding where states that have legalized it may be in kind of experiencing these trends. So maybe one final quick question for clinicians listening. What would be kind of the one takeaway you would want them to be aware of or maybe bring into their practice after listening to the podcast and reading your paper?
Yeah, that's a great question. So I think in this study, what we find is that increased cannabis use disorder and cannabis poisoning diagnosis taking place in states that have legalized both medical and recreational cannabis, which actually indicates that this increase in diagnosis can become or could become a burden on healthcare systems going forward. So especially since there's no accepted pharmacological treatment available for cannabis use disorder except for behavioral therapies. So clinicians can discuss cannabis use behavior with their patients as well as the harms associated with cannabis use. So there's, as we talked about earlier, about the increasing public perception that cannabis is relatively harmless. So clinicians can help educate patients on harmful aspects of cannabis use, such as that people can become addictive to cannabis and can experience poisoning events with the cannabis or inappropriate use of cannabis. So I think educating the patients is the key in terms of these legislations.
I think that's a nice way to end on, helping people make more informed decisions with information. So I'm Dr. John Torous. I've been speaking with Dr. Jayawardhana about the association of state cannabis legalization with cannabis use disorder and cannabis poisoning, evidence from employer-sponsored health insurance. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at JAMA Network. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.